In the repair of ventral hernia defects using an open intraperitoneal technique, there are multiple approaches available to surgeons. This approach features fixation of Ethicon's Proceed surgical mesh in the intra-abdominal space using stay sutures to create a folded lip around the edge of the mesh. Begin the procedure by identifying the margins of the hernia defect. Make a midline incision across its entire length. Dissect the hernia sac away from the surrounding tissue. Next, enter the peritoneal cavity. Using careful adhesiolysis, free up any viscera attached to the peritoneum. Measure the defect and determine the appropriate size for the Proceed mesh to ensure a 3 to 5 centimeter overlap beyond the margins of the defect. When measuring the mesh, allow for an adequate overlap onto healthy tissue, and be sure to allow for the folded lip that will be created around the circumference of the mesh. If necessary, the Proceed mesh may be trimmed to size. At this point, there are two options for creating a folded lip in the mesh. The first option is to pre-place the sutures in the mesh to create a folded lip. And the second option is to create a lip in the mesh once it is placed. To continue with the first option, pre-place non-absorbable sutures in the mesh so that the free ends extend out from the ORC, oxidized regenerated cellulose, side. Suture placement should be approximately 1 centimeter from the edge of the mesh to allow for the creation of a folded lip. Attach the sutures circumferentially around the mesh. For example, sutures may be placed at the 3, 6, 9, and 12 o'clock positions. Next, parachute the mesh into the abdominal cavity with the blue stripes facing the peritoneum while centering the mesh on the defect. Continue by using the sutures to create a folded lip around the circumference of the mesh. A suture passer or Revirden needle may be used to facilitate placement of the sutures through the abdominal wall. Another option is to first place the mesh in the abdominal cavity and then use the transfascial stay sutures to create a 1 centimeter folded lip in the mesh. Like the first option, a suture passer or Revirden needle may be used to facilitate suture placement. Once the folded lip is created, fixation may be accomplished with devices such as tackers, anchors, staples, or additional non-absorbable sutures. A sufficient number of fixation points should be placed approximately 6.5 to 12.5 millimeters apart along the borders of the Proceed mesh. The mesh should be placed under some tension to avoid bulging or wrinkling once the sac is closed. This method also helps avoid dislodging, curling of the mesh edges, or herniation of the bowel between the fixation points. After securing the mesh, the fascia on top of the mesh can be closed using standard surgical techniques. Again, remember to avoid wrinkling of the mesh during this step. Subcutaneous and deep dermal layers may be closed using sutures. Finally, the skin may be closed with topical skin adhesive.